So today we are going to talk about sleep training in children. And I know in the past we have kind of spoken about behavioral strategies, techniques, data collection, um, and all of those things that kind of help you quantify things or really understand why we need to pay attention to data and how we collect data. And from today, we're not really exactly shifting gears. I think, moving forward, it's important to keep the whole data aspect in mind because those will bleed into the sessions moving forward. But from today, we are going to talk about some of those essential skills and almost like things that are needed for healthy functioning, things like sleep, which we'll talk about today, and things like feeding and toilet training, which we'll talk about tomorrow and then also next Saturday. But today we're going to focus on sleep training. And we have two speakers today. We have Dr. Morgan Eldridge. Dr. Morgan Eldridge is a postdoctoral fellow at the University of Nebraska Medical Center at the Mundermeier Institute. She received her Bachelor of Arts in Psychology from the Eastern Illinois University in 2014 and her PhD in School Psychology from Northern Illinois University in 2020. She completed her predoctoral internship at the Mundermeier Institute in the Behavioral Pediatrics Integrated Care Program. Her treatment interests really focus on the implementation of sustainable, integrated, and evidence-based, school-based mental health services. So thank you, Dr. Eldridge, for being here. We also have Dr. Emily Defouw. Dr. Defouw is a postdoctoral fellow with the Center for Intervention Research in the Schools. She received her Bachelor of Science in Psychology from the University of Southern Carolina in 2014. Emily is also a board certified behavioral analyst, and she earned her PhD also in school psychology from the University of Massachusetts, Boston in 2020. So Dr. Eldridge and Dr. Defouw actually completed their predoctoral internship at the same location, which is at the Mundermeier Institute, and in the same department, Behavioral Pediatrics Integrated Care Program. So I too did my internship at the same location, different departments, so that's how we kind of know each other. Dr. Defouw's research interests focus on evaluating treatment intensity and implementation for research-based math interventions, kind of delivered within a response to intervention, which we call here the RTI framework, and also culturally and contextually relevant class-wide behavioral interventions in the schools. And for those of you who have been with us for all of our sessions, or at least some, I am a postdoctoral fellow in the Department of Educational Psychology at the University of Utah. Again, same place where I did my pre-doc internship, and I have a PhD in school psychology from Mississippi State University, also graduated in 2020. So thank you all for being here. Thank you for your time. I know it's 10:30 in the night for Dr. Eldridge, and Dr. Defouw, what time is it for you?
It's 11:30 p.m.
So thank you for your commitment and your effort and your time.
Thank you for having us.
No worries. Okay, just gonna let folks in the meantime. So today we're gonna talk about sleep training. And really we have three defined goals, which are actually gonna be super useful and essential. And I know we have caregivers here, we have educators, we have therapists. So I'm sure, y'all do work with children ages essentially birth to 18 years of age. So we'll kind of actually, our two speakers here will kind of cover sleep recommendations for, a wide age gap. They will also kind of focus on identifying and developing ways to monitor your child's sleep. Like how do we collect data when it comes to sleeping? That's super tricky, but I think it's also a useful skill and helpful knowledge to have. They will also talk about sleep hygiene and how do we help kids improve their sleep hygiene. So interesting topics lined up. Without further ado, I'm going to stop sharing my screen and hand over, oops, sorry, sharing rights to our speakers so that they can go ahead and get started.
All right, thank you. Oh, all right. I'm going to go ahead and share my screen. Okay. So thank you for having us and thank you for that introduction, Chat. Yes, today we are going to be talking about sleep. And as Chat already mentioned, these are our learning goals for today. We're going to talk about recommendations, how to really figure out what's happening with sleep, to collect that data, and then to learn a couple different strategies about sleep hygiene.
Want me to go ahead, Emily?
Yep, go ahead.
Yeah, thank you all for being here, I guess, this morning for you guys. We're super grateful to be able to be here and do this presentation and talk with you all. Thanks for the introduction, Chat. So like she mentioned, I'm Dr. Morgan Eldridge, and this is Dr. Emily Defouw. And I think we just wanted to give a short disclaimer at the beginning. Emily and I thought it was important to recognize that as psychologists trained in the United States, our clinical practice certainly is influenced by our American culture, as well as like our research findings and the statistics and the strategies we're going to be sharing with you all have mostly, if not all, been like tested with children and family in the United States. So we just want to acknowledge that that's a factor here. And then we know that sleep is influenced by our cultural context. So the way that we interpret sleep may differ from the way that you all do. And we really want to invite an open discussion to learn how your sleep practices or how sleep looks in your families or for the families that you serve may look differently than it does for us. And we want to be able to invite you guys to share how these potential differences might look so that we can provide you with meaningful recommendations that actually apply to your families.
Yeah. Thank you, Morgan, for that. So jumping in, let's go ahead and talk about general sleep recommendations. And when we think about this, we're going to be thinking about how much sleep is enough. And so I have created this spectrum right here, and I was hoping that we could maybe use the chat feature. And if some of you could just put in your guesses for really any of these is how much sleep should a child be getting that's a newborn who's 0 to 3 months old? How many hours do you think that would be compared to a child who's in the preschool age around 3 to 5 years? So I welcome any guesses out there. And if Morgan and chat, if you, I'm not able to see the chat feature right now. So if you could let me know.
Sure, Emily.
Thank you. So we have 8 hours. 8 hours, any guess, is that for newborn? Is that what we are thinking right now?
Correct, 18 to
Newborn,
20.
18 to 20 hours. Okay. All right, so let's see. It's actually 14 to 17 hours. So we had a lot of people who were in that ballpark. Yes, exactly. Now for infants, yes, I see someone says more than 10 hours. Any other thoughts for infants?
Yeah, newborn about 18. Yeah, 18 to 20 was the most common guess.
Yes. And it's actually less according to the recommendations by the CDC that it's 14 to 17 hours. For an infant, recommendations are 12 to 16 hours. And feel free to type in the chat if you have any other guesses for any of these other ages. Toddler is 11 to 14 hours. Preschool is 10 to 13. School age is 11 to 12. And then adolescence is 8 to 10. So as you can see, as the child gets older, about an hour is taken off of this range. And by the time they become 13, it's actually really consistent with what the recommendation is for sleep for adults. So we talked a little about those recommendations just to give us a sense of like how much sleep is enough. So now that we have an idea of how much sleep that you want that specific child to get according to their age, I want to take a step back and talk about how do you monitor sleep, and specifically how do you identify and develop ways to track sleep, because Jack kind of mentioned this earlier. It can be kind of it can be kind of tricky to track sleep, because especially when you're thinking about yourself, you need to get that sleep so you're well rested to be able to do all of your daily activities. So one way to start thinking about how to talk about what's going on with your child's sleep is first just ask yourself these basic questions. So generally, how is your child's sleep? How would you describe this? Would you describe it as they wake up often? Is it difficult to put them to bed? Are they waking up super early, or are they sleeping all the way throughout the night? Just describing what's going on with your child's sleep. And then to take that step even further when we're screening for sleeping concerns, we can use the acronym of BEARS. So when we use BEARS, we can ask ourselves, okay, so B stands for bedtime. What time are they going to bed? E, are they having excessive daytime sleepiness? A for waking up. What time are they waking up in the morning? R is for how regular their sleep is. Is it pretty consistent with the wake up and the bedtime? And then S is for snoring. Snoring can be really important because it allows us to see if there's something medically occurring that may be the reason why your child is having more difficulties with sleep. So after you're able to kind of get a little sense of that type of data, a more specific way that you can monitor your child's sleep is through a sleep diary. And I'm going to show you an example of this on the next slide. But basically what a sleep diary does is it measures the parent's report or the perception of the child's sleep. So you're able to, as a parent, say, this is what the bedtime is. This is when they fell asleep. This is when they woke up during the night. Was there any napping throughout the day? And how long were they sleeping? And so the sleep diary is really nice because you're able to figure out all these different components that go into those bears and see what is happening with your child's sleep. And then it's also nice is that it's a written log. And so because it's a written log, you can do this multiple times and you can compare it across the night. So for example, you can look at the weekend sleep versus the weekday sleep. Some advantages of a sleep diary is that it's inexpensive and it is time efficient. So this measure is, you can do this on a piece of paper, you can do it on a computer. You don't need any expensive systems to do this. It's also really easy to compare sleep recommendations as I had in that one slide. Yes, chat, exactly. Think of it as a journal. You're journaling how much sleep is happening. And then another advantage is it's a really good baseline before you do some of the interventions that Morgan's going to talk about later. You can have this sleep diary be this journal of what your child is sleeping, and then be able to compare it to see if what you're doing is actually working. There are some limitations though. One limitation is that sometimes parents are unaware if their child wakes up in the middle of the night because you're sleeping, and it's sometimes, unless your child comes into your room and wakes you up, you sometimes don't know that they are awake. Another difficulty or limitation with a sleep diary is that sometimes it's hard to remember to fill out the log. Sometimes we have so many demands that are on us and so many things that we need to do at night and in the morning that we sometimes forget to do it. So that's one limitation. Let's see. So this is an example of a sleep diary. So basically what it is, sorry, I was just looking at the chat room. Yes, it's just like baseline data when we collect before an intervention. So this is an example of a sleep diary. So you would have the day, the date, and then you would have the hours that, that would occur. So basically what this example is showing us is that at 7:55, that's when we put the child down in their bed to fall asleep. They did not fall asleep though until 8:15. So we represent that by an I. And then from there, we shade in all of the hours that they were asleep. So they were asleep at 9, 10, 11, and 12 a.m. But then at 1:23 a.m., they wake up. So you note that on the chart, how many times they wake up. But they fall back asleep between 2 to 5 a.m. And then at 6:30 a.m., you notice that they wet the bed, they forgot to put a pull up on, but they're up just briefly. And then finally, for the sleep diary, you'll say that they went back to sleep and then they were out of bed at 7:30. One thing important to note is that with a sleep diary, it's recommended that you check in on your child sleeping right before you go to bed. So in this example, the bedtime for the parent was 11 p.m. So they just went in to see if the child was asleep and they were. So that is just a very basic, easy way to track how your child is sleeping. Again, what time they're going to bed, how much time it takes them to fall asleep, and then how many times they're waking up. Is there anything happening in between in the night, and then their wake up time. And Morgan and I have an example of this data sheet. Chat, if we're able to share this with any participants, if they're interested, afterwards, we'd be happy to do that.
Sure, can do that, thanks.
So Morgan's going to take it over from here and she's going to talk about sleep interventions.
Yeah, thanks, Emily. So when we're thinking about sleep interventions, I'm going to talk to you all about some general best practices, sleep hygiene. So how do we kind of make our environment or set ourselves up for success to sleep well? And then a few strategies that have been tested or implemented with kids and families. Again, that's in the United States, so keeping that in mind too. Go ahead and switch, Emily, thanks. So some general best practices. In general, we promote evidence-based behavioral interventions, right? So things that we can do, that parents can do, that providers can help families do in their environment. And that's going to be our first choice of treatment for any pediatric sleep problems or disorders. So whether it's having trouble getting your child to fall asleep, having a lot of middle of the night waking up behavior, difficulty getting them up in the morning if they're super sleepy, what do we do about those things? And we're going to change behaviorally how we interact with them, how we set up their environment. And that's always going to be our first choice when we're trying to treat these things. A sort of additional line of defense would be medication. Emily and I are not prescribing doctors, so we don't promote the use of medication. So when we're thinking about medication and if that's a consideration for significant sleep difficulties, we always tell our families that to go to their doctors and ask for guidance and recommendations, because that family doctor is going to know the most about that child and the most about any medications that they would be prescribing to them. And then lastly, just if medication is used, being behavioral health providers, we always promote that it should be used in combination with non-medication treatments, so that behavioral intervention. So even if we have some pretty significant concerns and the doctor goes ahead and prescribes medication for that child, we still want to combine that with behavioral interventions for families. So sleep hygiene. So how do we set ourselves up for success for our children to sleep better? The bedroom environment is a big one. We want it to be as non-stimulating as possible. So what we mean by that is having limited access to electronics, things with blue light that tend to stimulate us and make us be more awake. We want to minimize the toys in the bed. So lots of kids, like to sleep with stuffed animals. That's okay, but we want to minimize any toys that are really interesting that might keep them up longer. We want our sleep environment to be relatively dark. It doesn't have to be pitch black. Some kids are scared of that, so it's okay to have some light, but we want it to be relatively dark because the light tricks our brain into thinking we need to be awake. Similarly, reasonably quiet. Doesn't have to be dead silent, but some like white noise, but we don't want anything loud that might be disrupting their sleep. We want to keep it at a comfortable and cool temperature. Research that we've done in the United States has shown that any temperature really above like 75 degrees makes it more difficult for people to sleep. And then having a familiar setting. So kids tend to sleep better in places that they're used to falling asleep in. So sometimes it can take kids, oh, thank you, chat. Yes, 75 degrees Fahrenheit. It can take kids time to adjust to falling asleep in unfamiliar settings, which is normal. Some other recommendations for kids is keeping a really consistent bedtime routine. So it's good to have a period of time before you put your child down for sleep that you're actually like engaging in some sort of bedtime routine. So that varies across families, but some examples might be like, brushing our teeth and then getting into bed and maybe we read something together, or maybe we talk a little bit before they go to sleep, just something that's predictable and consistent. So it's kind of priming them like, oh, when we do these things, then we're going to go to sleep. The other really important piece is a consistent sleep-wake schedule. Now, this is easier for kids, and on the next slide, I'll be talking about teens and how that can be more difficult, but we want to keep it pretty consistent. We want to be putting them to bed and waking them up at similar times every day of the week, even on the weekends, because if we don't, what can happen if kids sleep in on the weekends, it can be hard for them to go to bed at their typical bedtime, and then they start to accrue what we sometimes call like debt. So times where they didn't get enough sleep, so they are in sleep debt, and then they want to make up for it in not good ways, like napping. You can, yes, thank you, chat. So sleep hygiene for adolescents looks really similar. I think no electronics is a somewhat difficult one because at least here, most of the teens have smartphones. They like to spend a lot of time on them, but we want it to be not stimulating, dark, quiet, cool. Other recommendations, we really want to promote in teens that we're using our bed only for sleeping. So we don't want them to be doing homework in there or other things like that, because it actually tricks our brain into thinking, oh, when I get into bed, I stay awake and I do homework. So it makes it less likely that they'll be able to fall asleep. We want to keep a consistent bedtime routine. So we want to like wind down with less stimulating activities. Like rather than being on our phones or watching a TV show, maybe we read a book or write in our journal or whatever it is, something not so stimulating for them. Super important for adolescents. We want to keep a consistent sleep-wake schedule, which is really hard for them. I would say most teens want to sleep in on the weekends or stay up a little later. And staying up a little later isn't the worst thing, but sleeping in can really cause problems. So research shows that within like an hour of your typical bedtime and wake time is usually good. So if it varies within an hour, you're in a good spot. And then avoid napping. So teens are sleepy people, but we want them to avoid napping to catch up on that rest, because then it makes it harder for them to go to bed at night. Thank you, Emily. So Emily and I decided to include two pretty specific strategies that have been tested on kids and families in the United States and have shown to be really helpful in promoting independent sleep. So basically kids sleeping by themselves in their own beds. Now, again, at the beginning, I gave the disclaimer, this isn't always common in every culture to sleep independently, or to, have your own bed, or fall asleep independently. So this is something that we use a lot here, but I hope that we can have some discussions later in our Q&A about this too. So one way or strategy that we use here is a bedtime pass. So again, the purpose is we want to promote a kid falling asleep by themselves in their own bed. And the way the bedtime pass works is each night the parent gives their child, and it says a 5x7 card, but it could be really anything, that is known as the bedtime pass. So the kid gets this bedtime pass before bed, and the parents sit down and explain, okay, chat, I'm using you as my child, chat. Okay, chat, this is your bedtime pass, and it's good for one excused leave from the room per night. So they only get one chance to leave the room with this pass. And that could be for a number of things. It could be to use the bathroom, to get one more hug, to tell their parent about a scary dream, to get a drink. So commonly, we experience that kids, when they are having trouble initiating sleep, they'll come out of their rooms several times. And what ends up happening is the parents give them lots of attention, and the kid is essentially getting what they want out of the situation, right? They're delaying and escaping their sleep. So they're kind of winning. So this is one way that we decrease the amount of times they come out of their room, so that they can start to learn to initiate that sleep on their own, in their own beds. So after the pass is used, you get kind of one shot. The child is not allowed to leave the bedroom. And if they call out, we're really going to minimize attention. So we're not going to attend to them. We're going to kind of let them stay in their room. If they do come out, we're going to calmly and with the least amount of attention possible return them to their rooms and remind them it's time to go to sleep. And somewhat similarly, so that was the bedtime pass, again, to reduce the times the kid is coming out of the room, and to promote independent sleep. Similarly, the excuse me drill is something that was developed in the United States that also helps children fall asleep by themselves in their own beds. Thank you, Emily. So this one is, I wouldn't say more complicated, but it has a few more steps and considerations. So what a parent would do if they wanted to use this is the first night that they choose to implement it, and lots of parents choose to start it on a weekend day, because you really have to be consistent. It usually takes like 3 or 4 nights in a row for it to start to take effect. So and the reality is that if you have a child who has a difficult time initiating or falling asleep by themselves, it's likely that you might lose some sleep when you're trying to do this intervention. So starting on the weekend is, when they don't have work, is sometimes useful for parents. But the first night, you want to make sure the child's super sleepy. So we're going to move that bedtime a little bit later. We're going to keep them up maybe 15 or 30 minutes later than we normally would. So if their bedtime's at 8, we're going to keep them up till 8:30, and then we're going to start this intervention. So when we're in this pre-sleep period, right? So maybe it's our bedtime routine, we're brushing our teeth, we're reading our books, we're talking. We're gonna give lots of parental attention. We're gonna kind of give it freely. We're just gonna interact with the kid all throughout this period. But once we put them to bed, so when they're in this kind of like going to bed state, which would be like tucked in, lights off, right? It's time to go to bed. The parent would say, "Excuse me, chat, I need to go check on the laundry," or whatever it is. It could be anything that you can come up with. "I need to go use the bathroom. I need to do whatever. I'll be right back." Okay, so your kid is all tucked in bed, they're ready for sleep, and then you say, "Oh, excuse me, I'll be right back." And you leave the room, but you quickly return like seconds later. And you're gonna give them lots of positive praise or tell them what you like that they're doing when they're doing things that are compatible with sleeping. So lying down, being quiet. If they stayed tucked in, we're gonna go back in and we're gonna say, "Oh wow, chat, I love that you're lying quietly in your bed. That's really awesome." And then we're gonna give them a little attention. So we might rub their back or talk to them for just a few seconds. And then we're gonna keep continuing this cycle. So we're gonna interact with them, give them a little attention and praise for engaging in these things that we wanna see more of, these things that are in line with sleeping. And then we're gonna say, "Oh, excuse me, I'm gonna step out and do this thing really quick." And we're gonna make those times that we're outside of the room longer and longer. And the goal is we wanna make sure that the child falls asleep without us in the room. So we're gonna keep going in there as long as they're lying quietly, still tucked in, doing these sleepy behaviors. We're gonna give them a little bit of attention, then we're gonna remove ourselves maybe for 1 to 2 minutes. Then we're gonna go back, give them some attention, then we're gonna remove ourselves for a few minutes. And the goal is that as you keep doing that, over time, the child will fall asleep without you in the room. And that's the ultimate goal, is that they're able to do this independently without their parent. Some other considerations, you can go ahead, Emily. Thanks. Some other considerations, the child might make some requests. So they might, "Can I have a hug? Can I have a kiss? Can I have some water?" Whatever it might be. And parents can, grant those requests, but we only want them to do that when we enter in the room and the kid is doing what we want them to do. So they're lying down quietly. So if they make a request because we came back in and they were doing those things, we can go ahead and grant that request. Any inappropriate behaviors, we're going to want to ignore those. We're going to want to minimize our attention. We don't want them to learn that, oh, if I cry or scream or get up out of bed, I get a lot of attention from mom or dad. And then if the child leaves the room, and this is the part where it takes a lot of parents might be losing some sleep. Anytime the child leaves the room, they have to be returned every single time. So some things that we experience here commonly is that kids get up out of their beds in the middle of the night, and then they go into their parents' bed. And a lot of parents want their kids to sleep in their own beds by themselves. And so with this intervention, we would have to take chat and put her back in her bed and kind of repeat this "excuse me" drill until she fell asleep again. And then we would go back to our beds. So it's important that you do that every single time, because we don't want them to learn like, oh, if I wake up at 3 a.m., I can get in mom's bed because she's too tired to put me back to sleep.
And Morgan, I have a question for you. When the child does leave the room and you're bringing the child back to their bed, is this time, should you be saying something to the child? Should you be reminding them? What is your recommendation for that?
That's a really good question. Yeah, we still want to minimize as much attention as possible. So we don't want to make it super fun. We don't want it to turn into a game where Chat gets out of her bed because she knows she's going to get a lot of attention from me while I'm putting her back in her bed. So we want to just calmly and with as little attention as possible, put our kids back in their rooms and remind them like it's time to go to sleep.
Yeah, and with that, I also want to add, like, Dr. Eldridge said, it can be taxing and exhausting for parents to wake up at 2, 3 in the morning. But, as consistency is really important for this intervention. And, if there's more than one parent in the house, it's very important for, both the parents to be on the same page about how to do this, when to do this, and why, we all need to be on the same page. And same thing goes for grandparents, right? Sometimes our kids love to sneak into our grandparents' room, and sometimes our grandparents are not able to wake up and actually go put them back in their own bed. So something to keep in mind is when you are also choosing an intervention, just to make sure to ask yourself those questions: can I actually do this long term? And really choose kind of what works best.
That's a great point, Chat. Thanks for adding that.
And then Morgan and I have just created Morgan, sorry, were you finished? Okay, good. So Morgan and I just developed just a quick resources for you all to be able to use. One resource that I like is, it's called CBTI, and it's an app that you can download through the Apple Store or the Google Play Store. And the nice thing about this app is it has that sleep diary that I had mentioned previously that you can do on your smartphone, that you can be able to track it out. Another thing that I really like about this app is that it has a lot of recommendations that really aligns with what Morgan talked about with sleep hygiene, targeting those behavior aspects, but there's also cognitive strategies that we can also do. A lot of times we hear that, I can't fall asleep because I just can't turn my mind off. I have so many thoughts. And so the nice thing about this app is it has different strategies that you can do. So for example, after you download it and you go to the tools page, there's breathing tools that help you kind of calm your body and relax that. There's guided imagery. There's also times where it has in there that you can schedule times to worry, so you're not having those worry thoughts at night. And so I really recommend downloading that app. And it's actually really, I think it's most beneficial for our older kiddos, those kids that are adolescents in their teenage years. And so I do recommend downloading that if you're interested. And then Morgan and I did create a handout of the excuse me drill. And we also have that sleep diary that we will give to Chat that she'll be able to share with you. And then these other three resources are just good, helpful books to be able to understand helping children improve with their sleep.
I did have one quick question. Oh, sorry.
Oh, no, sorry. Go. Oh, no,
No, it's totally fine. So just this app, I know this presentation is for, kind of caters to children and adolescents, but, it's super helpful and important for parents to make sure they also have a good sleep hygiene, good sleep practices. So, because that makes them more successful, parenting their children to, practice good sleep. So do you think this app is something that even caregivers can use?
Oh, absolutely. I have colleagues that I work with that I know that use the app for themselves. So, yes.
Gotcha. Awesome. All righty. Thank you both.
Thank you.
This was very helpful, and I think very useful as well. And especially now that, kids were home for Christmas break, but there's also COVID, and, they may not need to wake up at 6:30 to catch the school van or the school bus. And maybe they probably have more relaxed wake up times, more relaxed sleep times. So just wanted to hear if anyone has any thoughts or any maybe specific questions to your household in terms of, any sleep challenges. We do have a good 10 minutes, so questions are welcome. feel free to use the chat. So while I'm just gonna give it a little time for folks to ask any questions, but yes, we did have one question, but I was actually gonna ask, sometimes it's very cultural that children sleep with parents, essentially on the same bed, and sometimes in the same room, but maybe a cot or a different bed, and it's just cultural, and also sometimes it's a preference, right? And so when it comes to this particular age, it's time to transition to their own room. And given that for X number of years kids have been sleeping with their parents or in their parents' room, just that transition makes it really hard. So any recommendations on how we can effectively transition kids to sleeping together, versus sleeping by themselves, essentially in their own room?
Yeah, I think that's a really good and important question. I think that like some of the strategies specifically that I was talking about, like the bedtime pass and the excuse me drill, would be good in that situation because the purpose of them is to promote independent sleep in their own rooms or their own beds. So I think those are some good potential strategies to start with. I know that at least the excuse me drill is a little bit more intense. So like you said, Chad, that's something to consider. But I also think just like with any transition, I think talking about it earlier on, introducing it, kind of pre-teaching, like you're gonna be sleeping in your own big kid bed soon, and talking to the kid about that and introducing them to their new room or their new bed and like making it a really fun experience. So I think similarly, anytime we're trying to transition a kid or teach them a new skill, we want to make it really fun and rewarding. So we want to pre-teach for them and then make it exciting. Like, do you want to try out your new bed? Do you like the way it looks? Let's see how it feels, something kind of fun and kid friendly, before you just throw them in there and expect them to adjust. And I think also being patient as parents and then as providers for parents, that it's going to take time because it's hard to adjust to transitions, and transitions are hard for everyone, but especially for kids.
Yeah, absolutely. I think that was very much aligned with what I would say, Morgan. I was going to say is definitely that communication up front, that this is what's going to happen, and it's as good, and yes, make it exciting. And if you can, reward your child for staying in their bed and for doing that. So yeah.
Yeah, thank you all. And I think that you all just like really hit the nail on the head. So introducing it, talking through it, giving it time, and just making it as gradual as possible. So, not catching them off guard by saying, tomorrow you're going to sleep in your own bed. But, maybe one time this week, let's try sleeping in your own bed. And then just gradually increasing the number of days as well. With that, we do have two questions. So, Kidmini, you had one question, falling asleep while working in school. That's actually a tricky one. It could be, I want to say, several factors. One depends on the age of the child. And like Emily mentioned, if it's, and I think Morgan too, if it's an adolescent, you know, their hormones are all over the place and they really want, you know, to sleep more and gain more sleep hours. It could be sleep debt, but it also could be physiological things, medication, if they're taking any, are they getting enough sleep in the first place? Kind of given the age of the child, are they getting the recommended number or hours of sleep? So there's several things, but if you have like a more specific question, I think we can help answer. But with this, I think there are several factors that actually play into this. Yeah, go ahead.
I was just gonna say, I agree with you, Chat, and I was just thinking when I read that, that this would be a really good place to, you know, implement like screening, and trying to consider like what is going on with this child's sleep. Is there something going on in the home setting that's making it hard for them to sleep, and then they're not getting enough rest and they're sleeping during school? So just really going back to kind of those bears, that acronym, and just like screening, like let's get a good picture of what this child's sleep actually looks like, because that'll lead you usually to an intervention.
Yeah, it's super important. And like, is this happening like almost every day at school versus like maybe once or twice a month at school? Yeah. So we do have another question. Does a kid 6 to 7 years old need a nap during the day? Because when they do have, the nap, they have more energy to do their homework in the evening. And that's really good, but they don't fall asleep at night.
I think
that
question right there summarized the problem we have with naps. Technically, for children that are between 6 and 7, they need 9 to 12 hours of sleep, and there aren't any recommendations for naps. So we really want to make sure that first off, that kiddos this age range are getting between 9 to 12 hours. And that would be my recommendation first, is to take a stab at that diary log or the sleep diary, and see how much sleep your child is getting at night. And because I would be curious, are they getting enough sleep at night, but also are they waking up? Just different variables to be able to look at, because you're right. Yes, they take a nap during the day. They have more energy to do their schoolwork and homework, but then at night they have such a hard time falling asleep. And one reason could be is that they actually have more sleep than they actually require. And so my recommendation is first is to take a stab at doing that diary log and to see how much sleep your child is getting. Morgan or Chat, do you have any?
I think that's in line with what I was thinking. I don't know that we have any specific, recommendations for napping. I really do think that what commonly happens, especially for kids and teens who are school aged, is school can be pretty taxing, and then they end up coming home and naps just happen, even if they're not planned. So I think, keeping them awake with, doing activities or whatever is really probably going to benefit them in the long run, rather than taking that nap and then having trouble falling asleep. And then what actually is happening is this kind of cycle, like, well, I couldn't fall asleep, so now I was tired, so I need a nap. So the nap is really just making up for the sleep that they lost, that they should have had at night.
Yeah, and to add to that as well, the calming, like if your child feels tired after school, which I'm pretty sure they do, just like calming things, like maybe slowing things down for them, whatever that looks like in your household, really. So maybe just sitting down and reading them a book. So like really helping them calm down rather than, letting them sleep. because clearly kind of disrupts their nighttime routine and nighttime sleep. And like Morgan said, it's just like this cycle. And you know, it's just like for us too. I mean, there are some people who can nap and then who can still fall asleep really well. But for some of us, like, you know, it works similar that how it works for kids. Like we nap and then we're not tired or we're not sleepy at night. So like we're up till 1, 2 in the morning, and you know, so it's, yeah, exactly. So yeah.
So Morgan, it sounds like she can tell us firsthand that there is this cycle when napping, and then you don't sleep and you just need those naps more and more.
Yep. These are really good questions. Thank you so much. Maybe we'll give it another minute to see if anyone has any last minute thoughts or questions. Okay. I'm going to quickly share my screen so can share with you the remaining couple of slides. Okay. Okay, so that was the Q&A. I know we were supposed to have a session last Friday, but there was an unfortunate circumstance, and we had to move our session, which was supposed to be feeding, from last Saturday to tomorrow. So we have Laura Phipps, who will actually talk about, you know, focus on feeding difficulties, feeding challenges, food selectivity. So if you have not registered for that, I will drop the link here. So feel free to register for that. And then also next Saturday, we have Kaylee McKella. She is a second-year doctoral candidate here in the school psychology program here at the University of Utah. She is essentially going to talk about toilet training in children. So really kind of like how Dr. Eldridge and Dr. Defouw spoke today about like strategies and interventions. She will kind of focus on similar things, but for toilet training. And difficulties with toilet training, how do we essentially toilet train? How do we identify if our children are ready to be toilet trained? So really, really relevant, essential topics. And the flyer for that isn't out yet, but I'm gonna drop the registration link for that here. So feel free to go ahead and register for that session. And that's all that we have today.